All right, well, it's a sad fact, but did you know that 45% of adults snore, and that 25% of married couples sleep apart because of snoring? Now, the Snoring Center is the nation's leading provider of minimally invasive, office-based treatment for snoring and sleep apnea. Dr. Craig Schwimmer is an old friend of the show who we haven't had on in a while. Welcome back, Dr. Schwimmer.
That's great to see you.
Now, the last time you were here, you're mostly located, the Snoring Center was mostly located right here in the DFW area, correct? You guys have expanded. It's obviously a very big issue. You've expanded throughout the country?
It is. So we now have offices not only in Dallas and Fort Worth, but in Houston, Chicago, Atlanta, Beverly Hills, and Newport Beach, California. And I think that this speaks to the importance of snoring and sleep in people's lives.
Yes. Well, you said 45% of adults are affected by this?
Absolutely.
Are you affected more as you get older? It seems as people get older, they start to develop this issue.
Yes. So age and weight are two big drivers for both snoring and sleep apnea. And as the population gets older and gets heavier, these problems become even more common.
Gotcha. And now, just so the viewers and myself as well, just to clarify, sleep apnea is when you wake yourself up because of lack of oxygen during the night?
So snoring and sleep apnea are really different points on a continuum.
Okay.
And sleep apnea is you're not only snoring and making a bunch of noise, but the tissue in your throat is vibrating so much that it's actually blocking your airway, and you have these repeated stop breathing spells during the night. And obviously this is a very serious medical condition, and it needs to be treated. And one of the problems is that the most common traditional treatment, which is this mask that we give people to wear, while very effective, is really hard for people to wear, and many people just don't wear it.
I imagine you have to sleep on your back if you're not a back sleeper, if you're a side sleeper, it's uncomfortable.
So many studies show that half of people who are given this mask don't wear it.
Gotcha.
And you need to treat sleep apnea, and the traditional alternative was surgery, but surgery is very invasive and very painful. And
it can actually probably or possibly be even more painful than the actual problem itself.
Absolutely.
Snoring.
Exactly. Sometimes the cure is worse than the disease.
Right. So what is your solution at the Snoring Center? So
what we do is we specialize in newer, minimally invasive, office-based treatments. And so we're staffed by board-certified ear, nose, and throat doctors, but instead of taking people to the operating room and doing surgery, we can perform newer, minimally invasive, office-based treatments that really allow a patient to come in, get evaluated and treated in a single visit, and return immediately to normal activity. So there's no downtime. It's remarkable. So
it's an outpatient type of treatment, you're saying?
In the office, local anesthesia.
Wow. And then you're done. You're snoring. You do not snore again.
Well,
or is this taken care of, or is it something you have to follow up with?
Nothing is perfect, but the treatments that we do in the office are as effective as traditional surgical options. So to be able to get 80 to 90% success rates in the office without pain, without time off of work is really quite remarkable.
Yeah, very much so. And I know Amy, we're going to talk to her because she likes to snore during the show occasionally, but we'll have to talk to her and see if we can't get her in your office. I'm kidding. I'm kidding. But so we can just call Snoring Center for an appointment, do an evaluation, and then how fast does this typically happen before you're cured, or at least...
So most people who come in are actually treated on the date of their initial evaluation, and it takes a couple of weeks before people really start to see significant improvement.
Wow. So if you have this issue, you can go in and immediately...
Come in, get fixed, and get back about your business.
And start sleeping with your loved one again.
Yeah, and sleeping better, getting healthy, restorative sleep.
Well, and that's the big thing, is people sometimes don't realize until they've had this treatment that they haven't been getting restful sleep.
Absolutely.
I'm sure you probably hear that from patients all the time.
And when you improve the quality of someone's sleep, you dramatically improve the quality of their life.
Perfect. Thank you so much for joining us. The
Pleasure.
Snoring Center has offices in Dallas and Fort Worth. If you want more information on either location, all you have to do is log on to snoringcenter.com. Amy, are you going to give something away for us?
Dr. Schwimmer, welcome back, by the way.
Well, thank you.
It's really good to see you. It's a big problem. Now, I know you cure snoring, but I talk in my sleep. Can you cure that? I can't stop talking. It's a big